people are going to say. I don't care if it's from the left or the right. I need the information because I really want to go back to Washington and tell my colleagues what's going on in southern Arizona and what the concerns of my constituents are. That resonated with me. That resonated with me a great deal. Because many of you who know me, I've been in the community for decades. I'm one of those who came here as a younger man and never left because even though I had great opportunities, it's such a beautiful, wonderful place to live. And so I've served my nation in the military. I've been a police officer. I've run a rescue service. I've worked with your sheriff and your police officers down here when I was in Peter County. And so I understand this community very, very well. And although I speak all over the country, really this is home. And I understand the culture that we all live in southern Arizona. As Surgeon General of the United States, you have a statutory responsibility. Your job description in the federal government is to protect, promote, and advance the health, safety, and security of the United States. It sounds real simple on paper. But let me tell you, just about every one of the issues that we have the privilege to deal with on behalf of you, the citizens, are some of the most polarized debates. And often, the politics overshadows the substantive issue. You know that, and I'm not telling you anything. And the reason I love my job so much as Surgeon General was I didn't have to deal with the left or the right. My job was to think through these complex issues and then provide elected leadership as well as citizens with the best information available so that they can make the right decisions. And I provide the guidance. I don't make the decisions. So whether it's the President of the United States, whether it's Congress, whether it's the Senate, or anybody else, the press searching for the right information, the Surgeon General is a trusted person. It's an iconic figure not only in this nation but the world because people understand that in the history of this position, the Surgeon General has always been a straight shooter, no matter what the issue is. So we're called not only by our own government, we're called upon by other nations to provide informed, non-biased, non-partisan input. So with that job definition in mind, what I'd like to tell you about just briefly and set the stage for the listening session that Congresswoman Giffords wants to have is the disease and economic burden that we have before us today. We are at a very critical juncture in the history of this nation. This has never happened before. You know what's going on. You read the press. You feel it. You feel the economy, the struggles that we're all going through. I feel it as the doctor of the nation, even now after leaving office, because we have almost 50 million people without insurance. Most of them are working poor. Not like they've been characterized as deadbeats, but most of them are working poor, who are struggling every day to just put bread on the table and keep their houses and keep their kids in school and keep them clothed. And so I look across and I see a nation that is spending $2.5 trillion a year on what we call health care. Folks, it's not health care, it's sick care. Let's not mistake the two. The fact is, we generated over decades a sick care system that is perversely incentivized. And what that means is, people like me, when I had the privilege to practice, and my colleagues, are rewarded economically to wait for you to get sick, to make you better episodically, and yet there's no real capacity in the system for us to keep you healthy. So that's what I mean by a perversely incentivized system. We're spending $2.5 trillion a year, it's almost 17% of our gross domestic product, on health care. If we don't change the trajectory we are on today, in the next few years we're going to hit 20%. In a decade and a half or so, we'll be at 25%. So we'll be at $4 trillion in the next few years. And yet, at the point we're at now with 17% of GDP and $2.5 trillion in expenditure, we can't afford it. Think about it. The legacy we will leave our children and our grandchildren is unsustainable unless at this critical juncture in our history's nation, we take some bold steps, corrective action to make this system more responsive to your needs, to be able to provide cost-effective care. With that $2.5 trillion that we spend, we should all be aware that 75 cents of every dollar we spend on health care is spent for a chronic disease. Most of those diseases are preventable. Think about that if you're a businessman and somebody tells you 3/4 of your revenue is going out the door for something that you can prevent, or at least mitigate. You'd be taking some bold steps, otherwise you probably wouldn't be in business for long. And that's part of what's happened. We keep putting Band-Aids on an antiquated system, people who mean well, and it's not working any longer. So as we move forward, there's a whole bunch of discussion going on. We have people on both sides, left and right, polarizing the debate, really not with substantive information. What we need now is clear thinking. We need informed individuals to sit around the table and come to terms with some very difficult problems, the likes of which we have not seen in the history of this nation. But if we don't do it, we can't afford the absence of leadership and not taking action that's appropriate. That's why these type of listening sessions are so important. We can't wait. We can't put it off another year or 2 years because of those people who don't have health care, because of the rising costs. So as we look at what's before us, we have to deal with issues of access. That is, how do we ensure that every American has an opportunity to get a basic set of